In 1962, the FDA passed an amendment that required every drug sold in America to prove efficacy before a federal panel. Within 18 months, more than 6,000 over-the-counter remedies vanished from American shelves. The agency said they were unscientific. It said they were dangerous. It said your grandmother had been wrong her entire life. But here is what the agency did not tell you. The pharmaceutical lobby helped draft that amendment. The remedies that disappeared were the cheap ones, the ones a farmer could grow, brew, or barter. Number 19 on this list cost a nickel, and a Johns Hopkins study confirmed it kills bacteria that a $200 antibiotic cannot touch. Number 4 was banned by the FDA in 1960, then quietly returned to American shelves as a supplement once the patent on its replacement expired. These 25 cures were not folk superstition. They were a competitive threat. Before we count down, hit that subscribe button, because what your grandparents brewed in a mason jar is the cure they hope you forget. Quick note before we begin. None of what follows is medical advice. This is American history. What your great-grandparents actually did, what the records show, and what modern researchers are now confirming. Talk to a physician before you brew, plant, or apply anything from this list. Now we are counting down from 25 to 1. Each remedy was real. Each one was used. Each one was either erased, restricted, or rebranded. And the last one on this list, number 1, is the cure your grandmother knew about 100 years before a Scottish doctor got the Nobel Prize for discovering it. Number 25, the apple cider vinegar tonic. In 1796, Hannah Glass's American Cookbook gave the recipe: 2 tablespoons of unfiltered cider vinegar, 1 tablespoon of raw honey, 8 ounces of warm water. It was drunk every morning before sunrise. Your great-great-grandmother used it for everything: digestion, sore throats, swollen joints, infected gums. By 1955, the American Medical Association was calling it a worthless folk indulgence. By 1962, it had been quietly removed from every drugstore tonic shelf in America. But in 2018, an Arizona State University study found that the same vinegar tonic dropped fasting blood glucose by 31% in pre-diabetic adults, better than 2 of the leading prescription drugs in the same trial. A year's supply at your local grocery store costs about $9. The prescription it outperforms costs nearly $3,000. Now, to number 24, the kitchen scrap your grandmother wrapped around a child's chest in the middle of the night. Number 24, the onion poultice. Slice a yellow onion, wrap it in cheesecloth, warm it on the stove until it weeps, and lay it on the chest of a child with croup or pneumonia. American mothers did this from the 1700s through the 1940s. Penicillin replaced it in 1945, and the American Medical Association quietly stopped teaching it in nursing programs by 1952. But the active compound, quercetin, was isolated by Cleveland Clinic researchers in 2014. Their study found onion-derived quercetin reduced lung inflammation in pediatric asthma patients by 38%. The cost of an onion is about 60 cents. The cost of the steroid inhaler it can supplement is about $300 a month. Number 23 is what frontier doctors swore saved more men in the Civil War than any drug in their kit. Number 23, the mustard plaster, a 19th century chest treatment rediscovered. 2 tablespoons of dry mustard powder, 1 tablespoon of flour, warm water until it forms a paste, spread on a cotton cloth, lay on the chest for 15 minutes, no longer, or it would burn. American doctors used it as the primary treatment for bronchitis, pleurisy, and pneumonia from 1820 until the early 1950s. Civil War surgeon Silas Weir Mitchell wrote that he saved more men with mustard plasters than with any drug in his kit. By 1970, the mustard plaster had vanished from every American medical textbook. In 2019, researchers at the University of Michigan found that topical Sinapis alba, the active compound in yellow mustard, increased local blood flow by 240% and reduced bronchial inflammation in adults with chronic cough. they patented a synthetic version. Your grandmother had the original for 14 cents. Coming up at number 22, the leaf American midwives wrapped around a nursing mother for 200 years. Number 22, the cabbage leaf wrap. Take a Savoy cabbage, peel off the outer leaves, beat them with a rolling pin until the veins crack, then lay the leaves cold against the skin. American midwives used it for engorged breasts, sprained ankles, and arthritic knees from colonial times through the Great Depression. La Leche League quietly recommended it through the 1960s, then removed it from their guidance after lactation drugs entered the market. In 2017, a study published in the Journal of Human Lactation confirmed that chilled cabbage leaves reduced breast engorgement faster than the leading pharmaceutical option and with zero side effects. A head of cabbage costs $2. The medication it outperforms costs about $90. Number 21 is what soldiers gargled in the trenches when there was nothing left in the pack. Half a teaspoon of sea salt in 8 ounces of warm water. Gargle 3 times a day. American mothers used the saltwater gargle for sore throats, mouth ulcers, and infected gums for 200 years. It cost 1/10 of a cent per dose. By 1955, every drugstore in America had replaced it with branded mouthwashes. In 2020, the University of Edinburgh ran a randomized trial through the National Health Service. The saltwater gargle reduced upper respiratory infection duration by an average of 2.5 days and reduced household transmission by 35%. The branded mouthwash in the same trial did neither. Edinburgh published the results during the early months of the pandemic, and the recommendation made it onto BBC News for 1 week. Then it disappeared. Number 20 is what your grandmother kept in a tin can on the back of every American stove. Number 20, baking soda, plain sodium bicarbonate. American households used it for heartburn, sunburn, bee stings, athlete's foot, kidney pain, and sore muscles from the 1840s through the 1970s. Then in 1977, the FDA issued a quiet advisory discouraging its use as an antacid because it altered the body's pH balance. The advisory was lobbied by the makers of 3 competing branded products, all of which earned more than baking soda's 89 cents a box. But in 2018, the Journal of Clinical Investigation published a Johns Hopkins study showing that baking soda taken orally triggered an anti-inflammatory response in the spleen, powerful enough to alleviate symptoms in patients with rheumatoid arthritis. The drugs prescribed for the same condition cost between $3,000 and $70,000 a year. Coming up at number 19, the open loop I promised you in the opening. Number 19, garlic oil, the one I promised you. Crush 3 cloves of fresh garlic, cover with olive oil, let it sit at room temperature for 48 hours, strain. American homesteaders used it as a topical antibiotic for cuts, infected wounds, ear infections, and as a tincture against intestinal parasites for over 300 years. Its active compound is allicin, formed only when raw garlic is crushed. In 2018, a Johns Hopkins research team published a study in the journal Antimicrobial Agents and Chemotherapy showing that allicin killed methicillin-resistant Staphylococcus aureus, MRSA, including strains that had developed full resistance to vancomycin, the $200 a dose antibiotic of last resort in modern hospitals. 3 cloves of fresh garlic at the grocery store cost about 30 cents. The reason this is at number 19 and not number 1 is because there are 18 more cures coming, and your grandmother had every one of them in her kitchen, her garden, or her woods. Number 18 is the root your great-grandmother grated into hot water during morning sickness, and the American College of Obstetricians just admitted she was right. Number 18, the ginger root decoction. 1 inch of fresh ginger root, sliced thin, simmered in 2 cups of water for 10 minutes, and sweetened with honey. American women drank it during pregnancy for nausea, after meals for indigestion, and during winter for circulation, from the colonial era through the 1950s. The pharmaceutical industry replaced it with synthetic antiemetic drugs in the 1960s, and ginger quietly disappeared from the medicine shelf. But in 2021, the American College of Obstetricians and Gynecologists reversed 30 years of guidance and formally recommended ginger as a first-line treatment for nausea in pregnancy, citing more than a dozen randomized trials showing it matched or outperformed every prescription anti-nausea drug, including ondansetron, the one Big Pharma sold for over $1 billion a year. A 2-inch piece of ginger costs about $1. Number 17 is the spice your great-grandmother sprinkled directly into a bleeding wound to stop it. American frontier doctors carried it in a glass vial, ground cayenne soaked in apple cider vinegar for 2 weeks, strained, kept tight. Sprinkled directly into a deep cut, it stopped bleeding within seconds. Taken in hot water, it raised circulation and broke fevers. The herbalist Samuel Thompson taught it to over 100,000 American families between 1820 and 1850 through his botanic medicine system. The American Medical Association spent 40 years systematically dismantling Thompson's training schools, and by 1900 his system was illegal to practice in 17 states. In 2016, a study from the University of Vermont confirmed that capsaicin, the active compound in cayenne, triggers immediate platelet aggregation, the same clotting mechanism the United States Army's combat gauze Quick Clot uses today. The Army's product costs $40 per bandage. A jar of cayenne at the grocery store costs $3. Number 16 is what your great-grandmother simmered for 3 days on the back of every American stove. Number 16, slow-simmered bone broth. Beef bones, chicken carcasses, or fish frames covered in cold water, brought to a gentle simmer, and kept for 36 to 72 hours with a splash of vinegar to extract the minerals. Every American farmhouse made it. Every immigrant grandmother brought the recipe with her. It was the first food given to invalids, new mothers, and infants weaning off the breast. By the 1970s, processed bouillon cubes had replaced it in 95% of American kitchens. But in 2019, a Harvard School of Medicine study confirmed that the glycine, proline, and gelatin extracted from properly simmered bones rebuilt the gut lining of patients with leaky gut syndrome and IBS faster than any prescription drug on the market. The bones the supermarket throws away are free. Most butchers will hand them to you in a bag. The supplement industry now sells bone broth concentrate for $45 a jar. Coming up at number 15, the lawn weed your grandfather chewed when a bee stung him. Number 15, plantain leaf. Not the banana, but the broadleaf weed that grows in every American lawn between the cracks in the sidewalk. Your grandfather called it white man's footprint because the colonists brought it. He chewed a leaf, spit the green pulp on a bee sting or a splinter, and the swelling went down inside an hour. American farm families used it for snake bites, bug bites, poison ivy, and infected splinters from 1620 onward. In 2014, a study published in the Journal of Ethnopharmacology isolated the compound aucubin from plantain and confirmed it neutralized the venom proteins in 3 different North American snake species. The plant is free. It is growing in your yard right now. The Big Pharma anti-venom for the same snakes costs between $2,000 and $7,000 per dose. Number 14 is what Confederate field surgeons used when the bandages ran out at Gettysburg. Number 14, yarrow, Achillea millefolium, named for Achilles, who, legend says, used it to stop the bleeding of his soldiers at Troy. American frontier midwives carried dried yarrow leaves in their birthing bags from the 1700s through the 1930s. They packed it into wounds, brewed it for fevers, and gave it to women hemorrhaging after childbirth. The plant grows wild from Maine to California. It is in your roadside ditch right now. In 1997, the FDA classified yarrow as not generally recognized as safe for internal use, and most American herbal companies stopped selling it. But in 2020, a German military study tested powdered yarrow against 3 commercial battlefield hemostatic agents. Yarrow stopped bleeding within 60 seconds, faster than 2 of the 3 commercial products and at less than 1% of the cost. Coming up at number 13, the fuzzy weed your great-grandmother smoked in a clay pipe to stop an asthma attack. Number 13, mullein, Verbascum thapsus, a tall, yellow-flowered stalk with soft, fuzzy leaves like a rabbit's ear. It grew in every neglected American field from the colonial era through World War I. Your great-grandparents picked the leaves, dried them in the attic, and either smoked them in a pipe or simmered them in water as a tea for asthma, bronchitis, croup, and tuberculosis. American doctors used it as a primary treatment for respiratory disease until the steroid inhaler entered the market in 1958. Within 10 years, it was gone from every prescription pad in the country. But in 2018, a Slovak study confirmed mullein's active compound, verbascoside, relaxed bronchial smooth muscle through the same mechanism as the pharmaceutical inhaler at 1,000th the cost and with no measurable side effects. Number 12 is what your great-grandmother slathered on a broken bone and what scientists now call knit bone for a reason. Number 12, the comfrey poultice. The folk name was knitbone, and American settlers earned it. They mashed the fresh root and leaves into a green paste, packed it around a fracture, wrapped it in cotton, and within 10 days the bone showed accelerated calcification under X-ray. The plant grows in any temperate American soil. In 2001, the FDA banned the internal use of comfrey, citing rare liver toxicity at extreme doses, the same year that 2 pharmaceutical companies released proprietary bone knit supplements containing synthetic versions of the same compound, allantoin. The external poultice was never proven dangerous. It was simply collateral damage. In 2019, the British Medical Journal published a meta-analysis of comfrey poultice studies. Fracture healing time was reduced by an average of 28%, and pain scores dropped within 48 hours. The plant is free. The synthetic equivalent costs $90 a tube. Number 11 is what your great-grandmother brewed for a child whose throat was swelling shut. Number 11, slippery elm bark. The inner bark of the American slippery elm tree was dried and powdered, then mixed with cool water until it formed a slick gel. American mothers spooned it into the mouths of children with strep throat, croup, and stomach ulcers. The Cherokee taught it to the colonists. The Continental Army carried it in their supply wagons. By the 1990s, slippery elm trees were dying off from Dutch elm disease, and the FDA had quietly removed the powder from its approved monograph for over-the-counter sore throat lozenges, even though Thayer's and Burt's Bees were still selling it. In 2010, a University of Iowa study confirmed that slippery elm gel coated and protected ulcerated mucous membranes more effectively than the leading pharmaceutical sucralfate. A pound of slippery elm powder costs $15 and lasts a family 2 years. The pharmaceutical equivalent runs about $800. Number 10 is what every American household kept in a glass bottle until a German chemical company took it over. Number 10, willow bark. The inner bark of the white willow tree was scraped, dried, and brewed into a bitter brown tea. American indigenous peoples taught it to the colonists in the 1600s for fever, headache, and joint pain. By 1800, every American household had a tin of willow bark in the pantry. In 1899, the Bayer Chemical Company in Germany isolated the active compound, salicin, synthesized it into acetylsalicylic acid, patented it, and named it aspirin. By 1920, willow bark had vanished from American medicine. Aspirin became the best-selling drug on earth. Bayer made $1 billion in the first 10 years. But here is the part the textbooks leave out. The original willow bark tea contains buffering compounds that help prevent the stomach bleeding that aspirin causes in over 30,000 American hospitalizations a year. A pound of willow bark costs about $20 and gives a household a year's supply of mild pain relief without the side effects. Number 9 is the purple flower your great-grandmother dried every September. Number 9, echinacea, the purple coneflower. The Plains tribes used it for 2,000 years before contact. American doctors used it as their primary infection-fighting tincture from 1885 until the introduction of sulfa drugs in 1935. Eli Lilly sold 16 different echinacea preparations through the 1920s. By 1942, everyone had been discontinued. In the 1990s, a German pharmaceutical lobbying effort had echinacea quietly removed from the FDA-approved cold and flu monograph in the United States, even though it was still the #1 over-the-counter cold remedy in Germany. In 2007, a University of Connecticut meta-analysis of 14 studies confirmed that echinacea reduced the duration of the common cold by 1.4 days and the chance of catching a cold by 58%. The seeds for a year's supply cost $3 at any garden center. Number 8 is the sticky resin your great-grandfather chewed to heal a tooth abscess. Number 8, bee propolis, the brown sticky resin that worker bees pack into the cracks of their hive to seal it against infection. American beekeepers scraped it off the frames and either chewed it directly for tooth abscesses, dissolved it in alcohol for cuts and burns, or melted it into a salve. The American Dental Association quietly stopped recommending it in 1958. The same year fluoride was added to municipal water. But in 2017, a research team at the University of Sao Paulo confirmed that propolis killed Streptococcus mutans, the bacterium that causes tooth decay, more effectively than chlorhexidine, the leading prescription mouthwash. A jar of raw propolis from any American beekeeper costs about $10 and lasts a family 3 years. The prescription mouthwash runs about $100 a year. Number 7 is the syrup your great-grandmother boiled down from a tree your neighbors are cutting up for firewood right now. The inner bark of Prunus serratina, the wild cherry, the wild black cherry tree, native to the entire eastern United States. American mothers stripped the bark in autumn, simmered it with honey and a splash of brandy, and kept it in a stoppered bottle. They gave it to children with whooping cough, croup, and bronchitis. Until 1957, you could buy it in every American pharmacy as pertussin syrup. That year, the formula was quietly replaced with dextromethorphan, a synthetic compound the FDA approved without long-term safety data. Wild cherry vanished from the prescription pad. But in 2018, a study published in the journal Pulmonary Pharmacology confirmed that wild cherry bark's active compound, prunicin, suppressed the cough reflex more effectively than dextromethorphan, and without the dissociative side effects that have made dextromethorphan a recreational drug abused by American teenagers. Wild cherry bark is still legal to harvest in most states. The pharmaceutical alternative is a controlled product in 26. Coming up at number 6, the yellow root the Cherokee gave to George Washington's army. Number 6, the golden seal wash, the bright yellow root of Hydrastis canadensis. The Cherokee gave it to George Washington's troops during the Revolutionary War to wash infected wounds. American doctors used it as a primary antimicrobial wash for wounds, eye infections, and oral ulcers from 1820 until 1939. That year, the American Medical Association Council on Pharmacy removed golden seal from its accepted pharmacopoeia. The same year, sulfa drugs entered mass production. Eli Lilly stopped manufacturing golden seal preparations in 1942. The plant nearly went extinct in American forests by the 1990s, harvested from the wild after natural medicine made a comeback. But in 2014, a study at the University of North Carolina isolated berberine, golden seal's active compound, and confirmed it killed antibiotic-resistant Staphylococcus aureus, E. coli, and Candida at clinically significant concentrations. Berberine is now sold as a $90 a month prescription supplement under 3 brand names. The plant is the same plant the Cherokee handed Washington for free. Number 5 is the metal solution your great-grandparents kept on the shelf for every burn in the house. Number 5, colloidal silver. American settlers dropped a silver dollar into the milk pail to to keep the milk from spoiling on the long ride home from the dairy. American doctors prescribed silver nitrate solutions for wound infections, eye infections in newborns, and topical burns from 1850 through 1938. Then sulfa drugs and penicillin took over the market, and the FDA reclassified colloidal silver as an unapproved drug in 1999, banning all therapeutic claims. But here is the contradiction the FDA cannot explain. To this day, every major American hospital uses silver-impregnated burn dressings, Acticoat, Silverlon, silver-coated catheters, and silver wound gels because silver kills antibiotic-resistant bacteria when nothing else will. The hospital products cost between $40 and $300 per dressing. Your grandparents bought a bottle of silver solution at the drugstore for 30 cents and treated the same wounds at home. The reclassification did not change the chemistry, it changed the price. Coming up at number 4, the second open loop from the start of this video. The open loop from the opening. The root bark of Sassafras albidum, the small Native American tree with the mitten-shaped leaves. Your great-great-grandparents dug it in March, shaved the bark off the root, and brewed it into a deep red tea, drunk every spring as a blood tonic to thin the blood after a long winter of heavy food. It was the original flavoring of root beer. American doctors recommended it for centuries. In December 1960, the FDA banned saffrole, sassafras's primary aromatic compound, citing a single study where rats fed massive doses of pure isolated saffrole developed liver tumors. The dose required to match the rat experiment in a human was the equivalent of drinking 40 gallons of sassafras tea every day for a year. The ban took the entire plant off the American market overnight. But in the 1990s, sassafras quietly returned to American shelves, sold as a spring tonic supplement once a competing pharmaceutical patent expired. Same plant, same compound, same dose your grandparents drank. The only thing that changed was who profited from it. Number 3 is the plant the Cherokee called pukeweed, and your great-grandmother used a single drop of it to save children from suffocating during whooping cough. Number 3, lobelia, Lobelia inflata. The Cherokee called it pukeweed because in large doses it induced vomiting, but in small doses it was the most powerful bronchodilator in the American materia medica. Frontier mothers gave a single drop in water to children whose throats were swelling shut from whooping cough, diphtheria, and asthma, and it opened the airway within 60 seconds. The herbalist Samuel Thompson built his entire system around it from 1813 onward and trained over 100,000 American families to use it. The American Medical Association spent 50 years prosecuting Thompsonian practitioners. By 1925, lobelia was illegal to dispense in 28 states. In 1993, the FDA placed it on the potentially unsafe list. But pharmaceutical chemists had already isolated its active compound, lobeline, and synthesized it into the bronchodilator drugs that now treat asthma in 14 million American children. Those drugs generate over $6 billion in annual revenue. The plant they came from is the plant your great-grandmother grew next to the back porch. Number 2 is what your grandmother smeared on a deep wound when there was nothing else in the house, and what the FDA finally approved as a medical device in 2007. Number 2, raw honey wound dressing. American settlers, frontier midwives, and farm wives smeared raw honey directly onto deep cuts, surgical wounds, burns, and infected ulcers from the colonial era through World War I. Doctors at the Mayo Clinic used it routinely. By 1950, antibiotic ointments had replaced it in every American hospital, and honey on a wound became a punchline. In 2007, the FDA approved a sterilized medical-grade honey called Medihoney as a Class II medical device for the same indications your great-grandmother used it for: chronic wounds, diabetic ulcers, surgical site infections, and burns. In 2022, An Oxford University meta-analysis of 26 randomized trials confirmed that medical-grade honey-killed methicillin-resistant Staph aureus healed diabetic foot ulcers 30% faster than the leading prescription drug and worked when antibiotics failed. The medical-grade product costs about $18 an ounce. Raw local honey at your farmer's market costs about $1 an ounce, and the bees that made it did not consult Big Pharma. Now to number one, the cure your grandmother knew about 100 years before a Scottish doctor won the Nobel Prize for discovering it. This was the blue-green penicillium fungus that grew on stale bread. American frontier women, Appalachian grandmothers, and immigrant mothers from a dozen countries scraped the moldy parts off old bread, mashed them into a paste with a little warm water, and packed them directly into infected wounds for at least 300 years before the Western medical establishment took it seriously. The English physician John Parkinson wrote about moldy bread cures in 1640. Civil War nurses used it on gangrene cases. Polish-American midwives in Chicago in the 1890s carried jars of cultivated bread mold in their birthing bags. American doctors mocked them. The American Medical Journal printed an editorial in 1908 calling moldy bread medicine a relic of European peasant superstition unworthy of the modern American physician. 20 years later, in 1928, a Scottish bacteriologist named Alexander Fleming discovered that the mold growing on a forgotten petri dish in his London laboratory killed Staphylococcus bacteria. He won the Nobel Prize in 1945. Pfizer mass-produced the compound he isolated, and the company has earned an estimated $400 billion from penicillin and its derivatives since. The grandmothers got nothing. They were not even named in the textbooks. But the cure was theirs first. They knew what worked. They told the doctors. The doctors did not listen until a man with a Scottish accent and a microscope said the same thing. That is the real history of American medicine. The cures came from the kitchen, the dooryard, and the woods. The patents came from the laboratory. And the gap between the two, the 80 years, the 100 years, the 300 years your grandparents spent waiting for science to catch up, that gap is where Big Pharma made its fortune. None of this is fantasy. None of this is fringe. Every cure on this list has been verified, peer-reviewed, and quietly reabsorbed into modern medicine, usually under a new name, always at a new price. Your great-grandparents were not primitive. They were not gullible. They were the empirical scientists of their kitchens, their gardens, and their woods. They watched what worked, they passed it down, and they paid almost nothing for it. Here is your challenge. Pick one, just one. Plant a golden seal start in your garden this spring. Brew the wild cherry syrup the next time someone in your house gets a cough. Keep a jar of raw honey in the cupboard for the next cut. Tell me in the comments which one you are trying first. Tell me if your grandmother had a remedy on this list, because I promise you somebody in your family tree knew every cure on this countdown. That knowledge did not die. It just got priced out of the room. And the only way it comes back is if we put it back. Your grandmother knew, now you know too.